Right. I got one audience member in person, and then I've got two on the phone if they can say hi.
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 All right. Okay. Every overdose case in Athens-Clarke County is not just a statistic, but someone's friend, someone's child, or someone's parent who deserves access to help. A crisis is unfolding in our streets, schools, and homes, which is affecting those of every socioeconomic background. According to the Georgia Department of Public Health's Drug Surveillance Unit, statewide statistics show 1,530 emergency department visits for drug overdoses just in September 2025 alone. These statewide numbers highlight how widespread this problem is and its growing impact on communities throughout Georgia, like Athens-Clarke County. Unfortunately, access to treatment is often inaccessible to those who need it the most. While there are multiple treatment centers in the Athens-Clarke County area, barriers still exist that stand in the way. Financial barriers such as excess cost and lack of insurance coverage make access to treatment off the table for many. According to the National Center for Drug Abuse Statistics, an average 30-day inpatient stay in Georgia is around $18,500 without insurance coverage. Logistics, such as lack of transportation and fully booked programs, are another barrier. Many Athens-Clarke County residents rely on public transportation or walking as their means of travel. Treatment centers may be at too long of a distance, or people may be waitlisted so far out that help seems unattainable. Additionally, social stigma and fear of legal repercussions are keeping many users of illegal substances from getting help, even if it is available to them. These barriers are just a few examples as to why treatment is so inaccessible to many within our community. Reducing the use of illegal substances is essential if we want the Athens-Clarke County residents to flourish. Without access to treatment, those suffering will continue to be trapped in the cycle of substance abuse. Many in our community are struggling financially and emotionally due to illegal substance use. Local resources such as the police department, hospitals are becoming continuously overwhelmed by drug overdoses. The importance of finding a solution is undeniable, as this problem not only affects individuals, but families, public safety resources, and the well-being of the entire community. Our group did research on the local, state, and nationwide levels to gather the most accurate data about illegal substance use and how to solve it. By analyzing this data, we can confidently present a solution that best fits the Athens-Clarke County community's needs. Based on this data, I hope to persuade my audience that expanding and supporting accessible substance use treatment in Athens-Clarke County is the best solution to reduce illegal substance use and should be implemented. To support this, I will focus on three main points: the cost-effectiveness of accessible treatment, reducing harm and saving lives with prevention and early intervention, and finally, expanding current programs to meet the community's needs. Supporting and expanding accessible treatment for illegal substance users is not just a compassion solution, but an economically smart solution. The 2016 U.S. Surgeon General's report on alcohol, drugs, and health reveals that every dollar spent on substance use treatment saves $4 in healthcare cost and $7 in criminal justice cost. Currently, local funds are pouring into repeated ER visits, court costs, and police responding to overdoses. Yet, those same dollars can be invested in treatment centers and create long-term savings. When those struggling receive effective treatment, they are far less likely to continue the repeated cycle of drug abuse, which reduces costs for the community. Reducing the strain on hospitals, public safety, and local budgets allows for resources to be redirected into other community needs, such as improving the school system or improving public transportation. While supporting and expanding accessible treatment has clear financial benefits, its importance runs much deeper and directly impacts individuals' futures. Prevention and early access to treatment can dramatically reduce the risk of overdose and death caused by illegal substance use. Many people are first exposed to and begin struggling with substance abuse in adolescence. Shocking data from the National Center for Drug Abuse Statistics show that Georgia teen is 4.63% more likely to have used drugs in the last month than the average American teen. The urgency for early intervention and treatment is clear. The Georgia Budget and Policy Institution reports that drug overdose deaths are now on par with automobile crash deaths. To address this, Athens-Clarke County participates in the Drug-Free Community Program, DFC, which focuses on early prevention by minimizing substance use among youth before an addiction can develop. Community members unify, such as schools, law enforcement, and parents, to identify the early signs of substance use and reduce risk factors. By intervening early before misuse becomes addiction, programs like DFC reduce long-term harm, lower overdose risk, and help keep people from going down the path of illegal substance use in the first place. Beyond prevention and early intervention, expanding and supporting current treatment programs is essential for the Athens-Clarke County residents to combat illegal substance abuse. Our community can support local organizations through donating or volunteering. A couple of good options include Recovery Community Organization, People Living in Recovery, a peer-based recovery system offering community education, clothing assistance, housing assistance, trauma group meetings, and much more. As well as Divas Who Win, who strives to help women to overcome sex trafficking and addiction, offering a safe space to call home, employment, 12-step recovery program, and much more to develop long-term wellness. Methadone is an essential medication to those suffering with opioid substance use, and according to the Red and Black, 71 of the 159 counties in Georgia lack a methadone clinic within a 15-minute drive, creating serious and even life-threatening barriers for those who live in rural areas. Although there are opioid treatment centers in Athens-Clarke County, we have many community members who work or go to school here, but live in rural counties or have family members who do. Programs supervised by the court provide an alternative to incarceration for individuals who are struggling with illegal substance use and should get more support. The Western Judicial Circuit Felony Drug Court offers supervised intensive outpatient treatment for non-violent offenders, offering counseling, group therapy, and education. Structured treatment rather than incarceration is what a lot of these people need to continue forward and be productive members of society, all without having to put strain on the criminal justice system. By supporting and expanding these programs, such as free and nonprofit treatment centers and community organizations, access to medicine, and court-initiated treatments, this ensures that a wider network of people are getting help, therefore reducing and preventing harm from illegal substance use. Overall, expanding and supporting accessible treatment for illegal substance use in Athens-Clarke County is not just a compassionate solution, but an evidence-based solution. This is the best solution because investing in accessible treatment centers allows money to be saved, less strain on the community's resources, and will provide individuals with the tools they need to prosper. Supporting preventative and early treatment resources, such as the DFC program, protects vulnerable populations and reduces risk of future harm and even death. Expanding and supporting existing programs in the area, such as free resources, opioid treatment, and transportation, helps reach all of our community members to further reduce illegal substance use. I urge everyone within the Athens-Clarke County community to take action by supporting local organizations, by donating and spreading the message, and also advocating for expansion of affordable treatment and rural treatment. Through action, we can build a community in which treatment is accessible to all who need it, eliminating illegal substance use throughout the Athens-Clarke County community. Thank you so much, and I hope you enjoyed.